Meron na ba?
Okay. A pleasant good evening to everyone. So we are now here with our last session for clinical optometry. So last time we have discussed about diabetic retinopathy, and this is now the most common, common among Filipinos, even younger Filipinos at the age of 30 or even younger are having diabetic retinopathy. Okay. So I will be discussing the ocular disease in relation to neuro-optometric rehabilitation. So, yun yung ating magiging role, no? So, last time we have discussed biomicroscopy and as well as introduce optical coherent tomography. I remember when I went to Singapore, most of the optometrists practicing in Singapore, they have in their clinic the optical coherent tomography, no? Even I remember when I went to the University of Hong Kong, meron na sila noon. But here in the Philippines, because it's too expensive, very few, no? Only centers, ophthalmology centers have the OCT, no? So last time I have discussed diabetic retinopathy. Now I would like to review hypertensive retinopathy, no? So your role as a primary healthcare practitioner, through the fundus, you can determine whether the person is diabetic or the person is hypertensive, no? So, ano yung mga signs natin? If you notice the veins yung thicker, and then the arteries, no? Normally, the ratio should be 2:3. Now, when there is hypertensive retinopathy, you will notice narrowing of the arteries and even the veins, no? So, pag may nakikita na kayong ganyan, you better check the blood pressure of the patient. Pag meron na siyang mga exudates and hemorrhages, ibig sabihin medyo nag-a-advance na yung stage, no? So, when you look at the retina, no, pagka nakita nyo very fine yung arteries and veins, magsuspetsa kayo hypertensive to, and then has. And then we have grade 1 hypertensive retinopathy, grade 2, grade 3, and grade 4. So you can determine kano na ba katagal yung hypertension niya at anong grade, no? So the difference for grade 1, yung there is already arteriolar thickening, no? Yung ating mga blood vessels, nababalutan na yan ng mga taba, ano? And then tortoise, makurba. And then there is an increased reflectiveness, yung silver wiring. So, pag tinapat mo yung fundus light, ay yung ophthalmoscope light dun sa fundus, makikita mo parang makintab, no? Yung blood vessels, no? Yung arteries. So, yun ang tinatawag nating silver wiring. Saka, yan yung parang makikita nyo, parang kasi yung kanyang mga ugat nababalutan ng mga taba, no? And then grade 2, constriction of veins and arterial crossing. So, tingnan nyo yung crossing ng veins, no? At saka yung artery. Doon yung makikita na medyo constricted siya. Usually, mga 1, no? Kung normal is 2:3, baka makita nyo dyan, 1:2. Pag grade 3, there is already retinal ischemia, flame shape or blood hemorrhages, and cotton wool exudates. So, makikita nyo nagkakaroon ng exudates and papilledema, yung kanyang optic nerve medyo inflamed siya, no? So, take note of this. Take note also of the difference between diabetic retinopathy and hypertensive retinopathy. Sa diabetic, yung blood vessels, hindi siya nagko-constrict. Sa hypertensive, nagko-constrict siya. So, these are early signs na, kasi pag sinilip nyo, nakikita nyo, nagko-constrict na yung mga blood vessels, take the blood pressure and ask. And then, malay nyo, dahil sa inyo, naligtas nyo yung pasyente sa stroke, no? So, be watchful for these diabetic and hypertensive retinopathy signs, no? So, ano nangyayari? Kumakapal yung wall, no? Yung taba nababalot. Kaya minsan, nagla-blockage. And nandun, nagkakaroon din siya ng hemorrhage. So, the difference between diabetic and hypertensive, sa hypertensive, nagko-constrict yung mga blood vessels, no? And you will notice the cotton wool spots and then yung silver wiring, no? So makikita mo medyo may kintab dun sa blood vessels. Another posterior segment disorder na very common is glaucoma. So, diniscuss natin common, diabetic, hypertensive, then we have glaucoma. So, when you have glaucoma, there is increased intraocular pressure. And maraming causes. It may be secondary to cataract, no? I remember usually matatanda when they have cataract, no? Yung ating stages na from incipient stage, we go to the swelling stage, to the mature stage, and then the hyper-mature stage, no? Pagka yung pasyente is 70 years old up, they don't want to undergo surgery. I remember my mother, no? She was, I think, 70 plus. Talagang ayaw niya ng surgery. Then one day, the secretary of my husband was telling me, Mama does not want to stand up. Meron daw headaches, no? So when I look at her, sabi ko, what do you feel? Sabi niya, masakit. Masakit ang ulo and very weak, no? So I called the ophthalmologist because I saw nung flinash ko yung light, dilated yung kanyang pupil, no? And then dilated, and then very, yung slow, sluggish ang contraction. Sabi ko, yung cataract, nag-complications to glaucoma, no? And so, I called the ophthalmologist for a home call, no? Kasi hindi siya nakakalakad. And then, that night, emergency case. So, immediately went to the hospital, and yung evening na rin yun, na inano na yung kanyang glaucoma, yung kanyang cataract, para makontrol, no? Because this is a blinding disease. Kaya, very important for you na at the very onset, na nakita nyo ng may signs ng dilated pupil, sluggish, baka nandyan yung glaucoma. So, it's an emergency case. There are times na hindi mo na siya pwedeng pagbukas pa, no? So, we went direct to the hospital and everything was prepared for the surgery. Okay? So, be alert of this emergency condition. Meron naman glaucoma, paunti-unti lang, no? Hindi kagad, full-blown na kailangan ng immediate surgery. So, we have 4 stages, no? Yung cupping, tingnan nyo. Normally, it should be 0.3. So, when you see a 0.4, 0.5, or even bigger, no? That's already a sign that there is pressure inside. And what causes the pressure? Yung fluid na sa loob ng mata, no? Hindi siya maka-escape dun sa anterior humor area, anterior chamber, no? Merong obstruction doon. And in cataract, the swelling of the lens causes narrowing of that canal so that the pressure increases. And when the pressure increases, remember, the retina is pushed. May pressure dun sa retina. So what happened? The visual field, no, nagkakaroon na siya ng defects, no? So, nag-start na mag-enlarge dun sa blind spot, then nagkakaroon ng nasal step, oh. And then, pag nagkaroon na siya ng nasal step, lumalaki yung blind areas, no? So, nagkakaroon siya ng archway defects, then nagkakaroon siya ng early superior paracentral, and then finally, lumaki na yung blind area niya hanggang totally, no? And then what remains is a tunnel vision, no? Until finally, at the end stage, completely loss of vision. And remember this, whatever loss is forever lost. So, very important. Sa provinces, maraming glaucoma na misdiagnosed. So, maraming nabubulag because of that, no? So, let us be always aware to look at the pupil, no? Usually, pag meron tayong tinatawag na open angle and closed angle, so you have to make a differential diagnosis, and the best that you can is if you see that the pressure is not controlled, this is an emergency case, because if not, no remedy done immediately, it may cause blindness. And this blindness is irreversible. Ibig sabihin, pag nabulag na yan, na-damage yung mga retina and everything, mahirap mo nang ibalik yung vision. No? And maraming ganon na all of a sudden, nag-black out, hindi na ma-restore for whatever reasons. Kaya, very important, if you see the early sign, then if needed to refer immediately to an ophthalmologist, then refer them to an ophthalmologist. Okay. So, the World Health Organization classifies disease 11 of 2018 visual impairment into two groups, no? Distance and near presenting vision impairment. And for distance vision impairment, we have mild visual acuity worse than 612, moderate, 618, severe, 60/60, blindness 3/60. So that because of this classification of visual impairment, our role now is to do rehabilitation. No? So if you look at this, anong causes ng blindness, no? In the Philippines and all over the world? Uncorrected refractive errors, cataract, age-related macular degeneration, which we have discussed last time, glaucoma, diabetic retinopathy, corneal opacity, and trachoma. So, yan yung mga common cause of blindness, no? So, pag wala na tayong magawa at nabulag na talaga siya, then for them to get the PWD certification, kailangan you are able to categorize anong type ng blindness. Is it mild? Category 0. If it is moderate visual impairment, ang VA niya is 6/18. And if it is a severe visual impairment, ang visual acuity niya is 6/60. No? That is the VA with the maximum correction. Sa pinagtatalunan ngayon sa PWD, no? Na yung legal blindness, pwede na mag-claim ng PWD. Ang na-argue nila, pag binigyan mo naman ng salamin, lumilinaw yung paningin nila, so hindi dapat i-classify as PWD. So, take note of this category because it will help you in gauging whether yung patient that comes to you should be recommended to secure PWD IDs, no? So, ang blindness 3 is 3/60, then blindness 4, 1/60, and blindness 5 category, no light perception. And then, of course, may added, etc. No? So, what can we do as an optometrist? Halimbawa, nabulag na because of retinal degeneration, no? Or let's say because of the glaucoma, or because of the diabetic retinopathy. Kasi, if you notice, yung mga description natin, nagkakaroon ng hemorrhage, nagkakaroon ng exudates, nagkakaroon siya ng mga cotton wool, etc. dun sa fundus, no? Yung areas ng retina affected, hindi mo na siya ma-rejuvenate, no? So, kailangan i-rehabilitate mo. So, meron na siyang mga blind areas, meron na siyang mga scotoma. I remember in 2005, I was with Dr. Bian Tan, no? We went to the College of Optometry in Vision Development, and then we visited Bakersfield because there was a neuro-optometry in Bakersfield na I want Pia to undergo training, no? So, punta kami sa Bakersfield, and then I asked Dr. Suter whether Pia can be left there for 3 to 4 months for training in vision therapy. No? That's where I saw yung colorimeter. That's where I saw na the tinting of the lenses based on the needs, no? And then that's where also I bought this book, Light, Medicine of the Future. My daughter told me, Mama, you get this book kasi this is now the trend. So I got the book and I read it. Kaya kanina, if you saw the video about the sun, lagi tayong takot sa sun kasi iniisip natin yung effects ng UVA, UVB, and UVC, no? And sabi dito, the modern myth that the sun is dangerous to our well-being and claims that technological advancement such as fluorescent lighting, sunglasses, tanning lotion, and our indoor lifestyle may be more harmful than helpful. Integrating scientific research, clinical experiences, his own insight, Dr. Jacob Lieberman has worked effectively with more than 15,000 individuals from the learning disabled and physically, emotionally traumatized to business executive and Olympics athletes. The book discusses the use of light in the treatment of various cancers, depression, stress, visual problems, PMS, sexual dysfunction, learning disabilities, and the human immune system. So when I got the book and Dr. Suter gave me his book about neuro-optometry, I was really curious. Sabi ko, optometry is going into neuro-optometry practice. No? And the next year when I was invited to go to Denver for a Civitan convention, no? I was so excited because the first time I will meet personally Dr. Lynn Hellenstein, no? And then visit her clinic. And there I saw lights din ang ginagamit niya. The first time I saw the photosynthesizer. The first time I saw syntonic. The first time I saw also the various lenses, no? Sabi ko yung lenses pala, yung color niya, hindi lang pala basta-basta na based on passion. It has its own therapeutic value, no? So, sabi ko, hahanapin ko itong course ng phototherapy, no? After seeing all of this. So, if you notice, we have light therapies, no? And then we have various light that stimulates the eye. And it worked wonder. Nung nag-start na ako mag-practice, I have a lot of breakthroughs. Yung stroke na doble ang paningin, yung stroke na affected ang right weakness, after a month, vision therapy, lahat yun, gumagalaw na, wala na yung weakness, even yung weakness of the feet. No? So, amazing because the light stimulates the eye, the retina, the visual. It goes to the visual pathway and the brain. And when the light stimulus reaches the brain, hindi naman nag-stop yan eh. It goes to the various parts of the body. That's why yung body nagiging, yung mobility, na-enhance, no? So, it's really amazing. So, look at this, no? Yung sinasabi ko sa'yo, prepare the various types of lenses. If you notice, last time I discussed the pupils, sympathetic, parasympathetic. If there's something wrong with the sympathetic, you use the red lens filter. If there's something wrong with the parasympathetic, you use towards the blue. And to balance, you have to use the green. This is for the physical, no? Mamaya, medyo Dexter, medyo extend konti. Because I added something, no? So, last time we discussed pupillary reflexes. So, tingnan natin if the shape is okay, the reaction to light, the swinging flashlight test, pupillary reaction to a near stimulus. And let's see whether the pupil is equal, round, reactive to light, direct consensual, and then responsive to accommodation and near target. And I have shown you this video on how to do.
This is your swinging flashlight. Again, keep looking at the wall. I'm going to hold it still here. Now there's a little bit of a release there. You see that?
Yeah.
Small amount of fluctuation. Yep. Do the same thing here. You'll see after about a second and a half,
There it
starts
goes.
releasing.
So, my favorite mentor, si Phil Bulgaski, no? So, he was looking at the pupil. Tayong ginagawa natin, takpan, silipin. Takpan dito, silipin. That was what we have learned from school, no? So sorry that was the local system, but it should be the swinging light. O, ayan na maulit. So, dapat titingnan nyo yung pupil, no? So, I'll show it later. So, here we have, ano nangyayari? So, ayaw mag-video. So, here, you flash a light, you
right at the light. And when she looks at the light, they'll, and your eyes will converge and they'll get smaller. Okay.
That's how you do the accommodative reflex test. So let's go back to this. Ang sympathetic, yung pupil dilated. No? Dilated yung pupil. Pag dilated yung pupil, it inhibits saliva, relaxes bronchial, accelerate heartbeat, inhibits peristalsis and secretion, stimulate glucose, no? Production and release. So pag tinignan niyo yung diabetic patient, most likely makikita niyo dilated, no? So there is secretion of adrenaline and non-adrenaline, inhibits bladder contraction, stimulates organism. So pagka-sympathetic, yung mas dominant, dilated yung pupil, halimbawa 5 millimeters, kung gusto mo i-balance yun, mag-start ka dito sa color nito. No? So there should be a combination. For balance, it's green. The Symptophototherapy class 101 is on October 11 and 12 if you want to attend. So for parasympathetic nerve, no, constricted naman yung pupil. So pag constricted yung pupil, meron din mga corresponding Characteristic yung various parts of the body. Dilates pupil, inhibits saliva, relaxes bronchial, accelerates, bakit napunta ko sa sympathetic? Sympathetic, dilate, mukhang, parasympathetic. Constrict, bronchial, slow heartbeat, stimulates, no? So, pag nakita natin constricted, medyo dominant yung parasympathetic, kailangan i-balance yun. Okay? And that, you will learn all of this if you go to phototherapy course 101. I cannot teach it to you because you have to earn your certificate in order, a US certificate in order to practice. So, ano tinitingnan natin sa pupil, no? Pag nag-flash tayo ng light, magko-constrict yung pupil, no? Pero, before 10 seconds, nag-dilate siya, yun yung tinitingnan ng ating video. Tinitingnan niya, pag nag-flash ka ng light, nag-constrict yung pupil, and then, mame-maintain ba niya yung constriction 7 to 10 seconds. Pag hindi niya na-maintain, ang tawag natin doon is alpha omega pupil. So, ibig sabihin, yung parasympathetic at sympathetic niya, hindi balance. So, kailangan mo i-balance. Okay, that's neuro. So, yung mga cases natin na glaucoma, diabetic retinopathy, hypertensive retinopathy, the retina, all the retina are already affected. The visual field are affected. So, your role now is rehabilitate. Kaya nga tinatawag natin neuro-optometric rehabilitation. No? Neuro, you make use of phototherapy. No? Rehabilitation, you have to restore whatever you can restore to the maximum. Okay. So, that's the reason why yung stroke patient ko na dati hindi gumagalaw yung kanang mata, ay kamay, no? Tapos yung mata, nag-deviate, tapos doble tingin niya, and then yung light na dating doble, makikita na niya ng isa. No? So, yan ang practice ng neuro-optometric rehabilitation. Okay. So, again, I would like to emphasize, no? If you watch the video earlier, ang concept natin, hanggat maaari magpayong tayo, Doc Jinky, ha? Nasa Pittsburgh, Pennsylvania tayo, nakapayong ka, ha? Lagi siya may dalang payong. Nandun kami sa New York, sa statue, nakapayong siya. So, remove the, yung concept that sunlight is hazardous to us. The sunlight is, sabi nga, the future of medicine, no? There are certain wavelengths that are beneficiary to the eye and beneficiary to the body. All we have to do is learn ano ang dapat gamitin, ano ang dapat ayusin para maayos, no? Yung eye problems and then yung physical condition of the patient for their well-being, no? So, ako every morning, if there is a sun, I go to the sun, no? Because I feel na everything, yung mga toxin or whatever excess sugar I have, ilalabas mo yun ng pawis, no? So, of course, you have to go to the sunlight, yung early sunlight. That's very good for your body. So, I guess that's all for now. And we have invited a speaker that will discuss the how you can incorporate, no, nutrition in your practice. So, sa aking practice, that's what I'm doing. When I do neuro-optometric rehabilitation, it goes with nutrition, no? So, I use light stimulation, I use nutrition, and supplementation to enhance, no, yung retinal sensitivity. I have a student, si Dr. Isabel Pontas, no? Surprisingly, he visited me and I was surprised. Pinagmamalaki niya, I'm a sponsor of ABS-CBN sa kanilang Europe trip as they promote my pharmaceutical manufacturing firm, no? So, pinopromote yun sa kanya, no? And then, I remember when I have problems with color vision, sabi ko, I don't want to prescribe Apaxin because yung side effects. Do you have something that has vitamin A that will enhance the function of the retina, lalo na kung bulag na, no? Yung mga ganon. And she said, I have incorporated vitamin A. So she gave me, and that is one of the reasons I had breakthrough in the treatment of red and green deficiency. So, Dr. Leonor Almoro, can you introduce our speaker for tonight?
All right. Okay. Hello. Clear ba ako?
Loud and clear, Doctor.
Thank you, ma'am. Okay. Our speaker for tonight is a double certified professional, a registered nutritionist, dietitian from the University of the Philippines, Los Baños, a licensed physician, graduated Doctor of Medicine from the De La Salle Health Sciences Institute, Dasmariñas, Cavite. He finished the introductory courses on functional medicine and functional nutrition, treating the underlying causes of disease. He is also a book author, Nutritional Medicine, a guide to using food and nutrition in complementary medicine. He is currently the Medical Nutrition Director of Makalintal Doctors Clinic. He earned his diplomate in lifestyle medicine under the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine after topping the boards. He is also undergoing training for health optimization medicine under homehope.org and intends to pioneer the practice of health optimization medicine in Lipa City, Batangas. Do you know that our speaker tonight, during his past life, used to Dexter Makalintal?
Hello, magandang gabi po sa ating lahat. Thank you for that warm introduction, Tita Nori. Okay, so for this night, no, for tonight, we're going to discuss some cases. This is managing lifestyle-related eye diseases. I was asked to develop some slides for you, and then we'll discuss kung ano ba yung magagawa natin para sa ating mga pasyente. Ayan. Okay. So again, I am Dr. Makalintal. I'm a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, and an international affiliate of the Academy of Nutrition and Dietetics. Today, I am still studying health optimization medicine. So, bagong field po ito. This is how we optimize health and how we optimize the health of our patients holistically. And we don't actually call our patients, but we call them clients. No? Kasi ang patients po kasi ay mayroon pong negative connotation. So, okay, so let's start. I would like to introduce to you this slide. This is the continuum of diseases. Noong 1900s po kasi, there is a high incidence and prevalence of communicable diseases. Ano yan? Yan yung mga hypertension, hindi yan yung mga hypertension, yan yung mga diarrhea, mga enteritis natin, mga pneumonia, tuberculosis. No? And then, in 1997, there was a rise of numbers of heart diseases, diabetes, stroke, and cancer cases. And up till now, there is still increased morbidity and mortality of non-communicable diseases, to include your hypertension, your diabetes, your cancers, your strokes. And then kung mapapansin po ninyo, if we go back in time, in 1997, this is the year where tumaas din po yung pagdami noong mga fast food chains natin, tsaka nung ating mga noong mga processed foods na dumadating dito sa Pilipinas. And then would like to define ito pong non-communicable diseases. Your non-communicable diseases are also known as chronic diseases. They tend to be of long duration and are results of your genetic, physiological, environmental, and behavioral factors. Here in behavioral factors, this includes your diet, your sedentary lifestyle. May mga guilty po ba dyan? Mga kanakain natin ay puro mantika, mga ganyan. And then main types of your non-communicable diseases are cardiovascular diseases like your heart attacks, your strokes, and then your cancers and chronic respiratory diseases, to include your diabetes. This is from the World Health Organization website. And then, kung mapapansin po ninyo dito, sa next slide natin, ang dami pong kulay blue. Ang dami pong kulay blue na top causes of death in 2016. So the top causes of death in 2016 mainly are here, dito po sa graph na to, are non-communicable diseases. Ibig sabihin, mga hindi naisasalin o mga hindi nakukuha sa communication or hindi nakukuha o hindi nakakahawa. Mas marami po sa kanila ay yung po mga dahil sa ating mga pamumuhay or uri ng ating pamumuhay. Ng diabetes, may kilala ba kayo may diabetes? Yung mga may mga problema po sa heart, yung mga may problema po sa hypertension. And then timely po na diniscuss natin kanina yung diabetic retinopathy and your hypertensive retinopathy. So later we'll go on to that. So just an introduction, let's zero in first on diabetes mellitus. Diabetes mellitus are two words na nagsimula po sa Greek and Latin words. Ibig sabihin kasi niyan, baka hindi niyo pa na-encounter kung ano ba ibig sabihin ng diabetes mellitus. Ang ibig sabihin po ng diabetes ay in passing of, and your mellitus means the sweet. So in passing of the sweet. So diyan kaya po totoo po yung mga sinasabi ng ating mga kaibigan na mayroon pong diabetes, na minsan ang kanila pong ihi nilalanggam, So yan, it is a condition where there is too much blood sugar which triggers a cascade of reactions giving out symptoms. Ang nangyayari po kasi sa diabetes, ang kwento niyan, hindi po nakakapasok yung asukal na nasa dugo doon sa ating cells. Kapag ka po ganoon, tumitigil sila doon sa bloodstream. That's why ang daming nagkakaroon ng napakarami pong sakit, So ang diabetes po, ayon po sa aming pag-aaral, ay nagagamot or pwede pong magkaroon ng lunas, So yung kung may kilala po kayo may diabetes din, malulunasan po ito, So and if we zero in on the causes of your diabetes, ito po yan, This is the ominous octet. And then your ominous octet are the ones causing your hyperglycemia. Minsan hindi po nakagawa ng insulin yung ating katawan. Minsan yung masyadong madaming taba na breakdown, at marami pa pong iba, So dahil diyan tumataas po itong ating asukal, at pagtaas po ng asukal, marami nagkakaroon yung komplikasyon. Kapag po kasi masyadong madami yung asukal sa dugo, ang gugustuhin ng ating kidney ay mag-filter out. And then your filter, dahil filter ka ng filter, ang gugustuhin ng katawan mo, iihi ka naman ng iihi. At kapag ihi ka ng ihi, yun yung, minsan gumigising pa kayo sa gabi, tapos naiihi kayo. That's what you call nocturia or polyuria. And then kapag po kayo ay ihi ng ihi, gusto ng katawan natin na i-replenish yan. And kapag nag-replenish tayo, gusto natin laging inom ng inom. Parang ganito, inom ng inom. So, dahil nga inom ng inom, laging parang akala mo hydrated ka na. And then, on the other side, ang nangyayari po ay, dahil nga hindi siya nagagamit bilang energy, yung ating mga asukal, gusto natin kumain. So, wala kang energy, you gain, you sometimes lose weight, and then you gain more, na parang rebound dahil po kain tayo ng kain. And then, nagkakaroon po tayo ng mga komplikasyon. So, you have here stroke, Kasi ang problema pong diabetes ay merong multi-organ involvement. So, minsan nagkakaroon po ng diabetic foot, diabetic nephropathy, reduced blood flow, diabetic neuropathy, your diabetic cardiomyopathy, and your diabetic retinopathy right here. No, so we'll zero in later on diabetic retinopathy. No, and then your diabetic cardiomyopathy and stroke. Usually, this is caused by yung kapatid ng diabetes, which is atherosclerosis. And then kapag kakaroon tayo ng atherosclerosis, tumataas na rin po yung BP natin. Kaya yun pong hypertension ay kakambal ng diabetes. So usually yung mga pasyente po natin, if you can see, o may pang BP kayo sa inyong mga klinika, yun pong mga diabetic patients are also hypertensive, and vice versa. Yung ating mga hypertensive, sometimes they are also diabetic, or more often than not, 3 out of 5 cases usually are diabetic and hypertensive, or vice versa. So yun po yung nangyayari. So a diabetic retinopathy, a diabetic retinopathy is a complication of your diabetes, which affects the eyes, or specifically the back of your eyes, which is your retina. So sometimes it may cause no symptoms or just mild vision problems. So eventually it can cause blindness. And then it can develop in anyone who has type 1 or type 2 diabetes. So the longer that you have diabetes and the less controlled your blood sugar is, the more likely that you are to develop this complication of the eye. So ang nangyayari po dyan, no? Ang symptoms, you have your spots, you have your blurred vision, you have your fluctuating vision, impaired color vision, dark spots ng vision nyo, and then sometimes you even lose your vision. And then sabi ko nga po, diabetes has a multi-organ involvement. Kaya minsan sinasabi na rin natin na kapatid ng diabetes, kapatid po ng diabetes ang mga heart disease, ang stroke, dahil kapatid din ng diabetes or kakambal ng diabetes ang inyong hypertension. So let's zero in first on hypertension, and then later pag-ugnayin natin sila kung saan ba ito nagsisimula. No? Blood pressure, no? Define lang natin. Blood pressure is the force that a person's blood exerts against the walls of their blood vessel. So pagka tumataas po, no, tumataas yung puwersang ito, kapag kunyari ang inyong puso, no, kunyari ito ang inyong puso, titibok siya ng titibok, and then ang puso po kasi 24/7 siya tumitibok, and then ang gusto ng puso natin ay mag-pump ng blood to the other parts of the body. And then habang nagpa-pump siya ng blood, doon siya nagpa-pump doon sa inyong endothelium or doon sa inyong blood vessel, no? So kung ang blood vessel nyo ay ganito kabukas, no? And then dahil sa atherosclerosis or sobrang daming taba na nagde-deposit diyan, lumiliit yan. So parang hose na kapag ka po inyong pinigilan or lumiit yung butas, yung nangyayari, tumataas yung pressure, and that is what you call hypertension. Tumataas yung BP, and it can lead to severe health complications that increases your risk for heart disease, your stroke, and sometimes even death. So ayaw po natin mamatay kayo agad. No? And then hypertensive emergency, kapag sobrang taas ng inyong blood pressure, no, tumaas ang inyong blood pressure to 100 to 160 over 100, plus you have the evidence of impending irreversible hypertensive mediated end organ damage. So kasama po dyan, yun pong kapag nagkaroon ng problema sa kidney, which is an end organ. Kapag nagkaroon ng problema sa utak, nagkakaroon ng stroke, that is an end organ. Kapag po yung mata ninyo natin na apektuhan, that is an end organ. So kapag nagkaroon ng hypertensive retinopathy, or kapag nagkaroon ng hypertensive emergency, you are at risk of having hypertensive retinopathy, wherein the retinal vascula, there is a retinal vascular damage or nasisira yun pong mga blood vessels sa ating retina. This is caused by hypertension. Nasisira po kasi yun. Kasi kumbaga parang nagiging ischemic or hindi po nadadaluyan ng dugo dahil masyadong maitim or masyadong manipis yung pong ating blood vessel po doon sa ating retina. So signs usually develop late in the disease, and then your fundoscopic examination shows your arteriolar constriction, AV nicking, you have your vascular wall changes. Ito, yung mga flame-shaped hemorrhages, your cotton wool spots, your hard exudates, and your optic disc edema. Saan nyo pa nakita itong cotton wool spots? No? Yung cotton wool spots po ay nakikita nyo rin sa ating mga diabetic retinopathy. Also, some exudates are also present in your diabetic retinopathy. So sabi ko nga sa inyo, magkapatid sila. I'll show here some of some slides or some photos ng inyong fundoscopic examination sa mga may hypertensive retinopathy. So here your hard exudates. These are some of your flame-shaped hemorrhages. Ito mga to. And then you have here your mga leakings natin. So yeah. And then for this particular patient, medyo mataas din po yung kanyang cup disc ratio. So pwede rin siyang merong glaucoma. So ito, no, this is your blood hemorrhages or your flame-shaped hemorrhages. These are some cotton wool spots. These are some exudates. Your exudates or cotton wool spots are also seen in your diabetic retinopathy. Ito, disc edema, no? So mataas din tong ano nito. And then here, yung sinasabi ni Dr. na kanina, your copper wiring or silver wiring. And then your arteriolar narrowing. Kasi po, masyadong nagiging masikip or masyadong nagiging maigting or maliit yun pong ating dinadaluyan ng dugo. Kaya po nagkakaroon ng problema dyan. Okay? So, when you go to diabetic retinopathy, so ito ang pagkakaiba nila, no? Ang pagkakaiba nila, sometimes there are growth of your abnormal blood vessels. Ang daming kalat. That is your diabetic retinopathy. Kasi nagkakaroon minsan ng neovascularization. That is what you call neovascularization or pagkakaroon o pagtubo ng bagong blood vessels. Bago, blood vessel, your vascularization. So yan. You follow? Okay. So, the relationship of lifestyle diseases. No? Sabi ko nga sa inyo, magkapatid halos yung mga yan. And then, in lifestyle medicine or in functional medicine, this is how we take a look at the patient. Hindi po namin tinitingnan ng pasyente ng mata lang. Pagka nagpupunta sa amin ng pasyente, hindi namin tinitingnan na mata lang, hindi namin tinitingnan na tenga lang, or hindi namin tinitingnan na puso lang. So tinitingnan namin sila holistically. Usually kasi, the problem lies dito po sa 7 systems and doon sa gitna. So here, your assimilation system, this one is your, we have 7 systems by the way. So the assimilation system is the system wherein dito natin nakukuha yung ating mga raw materials. This is, dito nakukuha natin yung mga pagkain natin. No? So dyan kasama yung digestive system, your microbiome, or microbiota here, nakakatulong po kasi malaki yan. That is your mixture of your good and bad bacteria. Then we have here your defense and repair system na kumbaga ay ang sabi nga ay kung ikukumpara natin ito sa ating bansa, this is your sandatahang lakas ng Pilipinas. So if there is an invader na trigger yung ating immune response, at kapag na-trigger yung ating immune response, yan, nagkakaroon ka ng fever, nagkakaroon ka ng inflammation, no? So yan dyan. And then right here is your energy system. Energy system ay yung enerhiya mo, no? Kung paano mo kinukuha or paano mo nadadigest and then paano mo siya nagagawang energy. Right here is your biotransformation and elimination o yung mga toxins natin. This is how our toxins are eliminated. This is how our toxins are removed through the body. Then we also have your transport system. Kasama dyan yung cardiovascular system and lymphatics. Your communication system, dito yung mga neurotransmitters natin. And then dito sa structural integrity, this is how our bodies move. No? And then sa gitna po, your mental, emotional, and spiritual aspects of the patient or the client. So minsan ang sakit natin, kakaroon ng problema from the assimilation system going down or papunta sa loob or papalabas or minsan doble. No? So minsan yung pasyente natin kinakailangan din nila ng kausap. So we retell the patient's story, using your history, a thorough history, and then we devote our time explaining. Your antecedents or your mga genetics natin, yung mga environmental factors, triggering events. Ano kaya yung nag-trigger? Bakit siya nagkaroon nito? Baka na-aksidente siya. Your mediators naman, your contributors, kunwari, ano kaya yung kinakain niya for the past few weeks? And then your modifiable risk factors. You have sleep and relaxation, exercise, movement, stress and relationships, and of course your nutrition. And we're going to zero in on nutrition today. So dito po, no? So your lifestyle diseases kasi they arise from the way a person or a group of people lives. No? Paano sila nabubuhay? Uri na pamumuhay. That's why it's called lifestyle. Uri ng ating pamumuhay. Some cases are your atherosclerosis, your heart diseases, your stroke, your obesity. No? Obesity po isang sakit na rin. type 2 diabetes, and down the line. So it is also associated with your smoking, your alcohol consumption, and your drug abuse. So lifestyle talaga. No? So lifestyle talaga. So yan, makikita nyo, ganyan na tayo kumain yun. Ganyan na tayo kumain yun. Masyado ng madami. No? Tapos unhealthy pa, ang daming processed foods. Nakakakita ko dito, ang daming processed foods na kinakain niya. And then what will happen is that when you eat like that, you are constantly exposing your gut wall. Your gut wall, you are constantly exposing it to the harsh environment or potentially toxic materials from the environment. Specifically yung mga yung mga salted foods natin, yung mga processed foods natin, and then sometimes yung ating mga gamot din. And remember that 70% of the immune system is housed in the gut. And then when you do that, you trigger a cascade of inflammation, trigger a cascade of reactions, lalo kapag madaming masyadong histamine na nagde-develop yung katawan mo. So that's why ikakaroon ka ng tachycardia minsan. You develop problems with your cardiovascular system, hypertension right here. And then kapag ka sobra pa, you can also develop some other diseases, to include your diabetes. So bakit ko ito pinapakita? It is because our usual diet is like this. You have your added sugars, you have your cholesterol, you have your saturated and trans fats, you have a lot of sodium going on there, and you have processed grains and high calorie foods. And we are very low in your calcium, we're very low in fiber, we're very low in magnesium, potassium, vitamins A, C, D, E, and K, which are all vital, which are all vital for your daily needs, lalo sa ating immune system. And then this from your frontiers of immunology, this study links your high fat diets to a lot of diseases, specifically your type 2 diabetes, your cardiovascular diseases, your central nervous system, and then even cancer. So ito po kasi your high fat diets, they increase systemic inflammation, and when systemic inflammation sets in, dumadami na po yung ating mga sakit. And then alam naman natin na kapag nag-develop ka na ng diabetes, you are at risk of having your diabetic retinopathy. And if you have your cardiovascular disease and you have hypertension, tumataas na rin po ang iyong risk for hypertensive retinopathy, which damages your eyes, really your eyes. So ganito nangyayari sa katawan natin. And then dahil dyan sa high fat diets, nasisira din po yung ating gut microbiome. At kapag nasira yung ating gut microbiome, what happens is this one, yung po tinatawag natin na leaky gut. So your leaky gut is this one. So the normal gut wall is this one. Ang daming magkakadikit yung ating cells. So hindi nakakapasok yung inflammation. Kapag naman po leaky or inflamed yung ating gut wall, ito, madaling makakapasok yan to the bloodstream, and then going out to the other parts of the body, causing more inflammation. And then kapag nangyari yan, diyan na pumapasok yung free radicals. Diyan na pumapasok yung inyong mga free radicals, and then your free radicals will then travel to the different parts of the body. Minsan pupunta sila dun sa eyes. And then kapag pupunta na sila dun sa mata, nasisira na yung likod ng mata, specifically the retina. So this one, again, we have a lot of sugars, we have a lot of cholesterol, there's fats, there's sodium, and we are highly inflammatory. We are dealing with high degree of inflammation right here. And then mababa tayo sa ganito. Sobrang baba natin sa ganito. That's why the move is that we have to limit these foods. You have to limit these foods, your sugar-sweetened beverages, your processed meats, your fried foods, your processed snack foods and added fat sugars. You have your confections, high-fat dairy, red meats, poultry, and eggs. So, ang tanong ay, Doc Dex, magagamot po ba talaga ang diabetes? Paano po kaya namin magagamot itong mga hypertensive retinopathy, itong ating mga diabetic retinopathy, kung nandiyan na yan? So the answer is to treat the root cause, and the root cause mainly is their lifestyle. Kasi hindi naman sila magkakaroon ng ganyan kung hindi naman po at the very beginning nagkaroon ng insult or yung sinasabi natin insult is yung pagkakaroon noong ating mga nung pinagsimulang disease, specifically your diabetes mellitus. So may tanong po dito, how many eggs should we eat in a day? In a day, according to studies po, no, mas maganda po na kung hypertensive na tayo or tayo ay may diabetes na, we can limit your eggs to around 2 eggs per week, 2 to 3 eggs per week. Dahil po masyado pong mataas ang cholesterol ng itlog, lalo na yung ating yung egg yolk natin ay masyado po mataas. It has around 273 milligrams per deciliter, and then our allowable lamang po ay nandoon sa around 300 milligrams per deciliter natin. So yes, these are the top foods. These are the top foods to limit. We have to limit again. We have to limit. So is it not poultry preferable to pork or beef? Yes, it is preferable, but yung kinakain po kasi natin ngayon, yung mga kinakain po kasi natin ngayon na galing sa poultry, galing yung mga kinakain natin ngayon ay masyado po kasing madaming feeds, and then those feeds get into contact with our body, and then kapag nagkaganoon, nagkakaroon din tayo ng trigger of inflammation. And my take on ketogenic diet, later po pakita natin sa inyo ang study dyan. Okay? So the top foods to consume are your vegetables, to include your mushrooms. Why? Your vegetables, including your mushrooms, increases your antioxidants. And remember, yung sabi natin kanina, that if you have high-fat diet, ito na po yung ketogenic diet, if you have your high-fat diet, lalo kung hindi maganda pagkakagawa ng inyong ketogenic diet, especially kung hindi naman siya talaga epileptic ang pasyente, no? So there is no really benefit doon. Yes, you will lose weight. Yes, you will lose weight definitely kasi you will lose water weight eh. Pero what will happen is that you will trigger this one. Because your ketogenic diet is a high-fat diet, no? Since your ketogenic diet is a high-fat diet, mataas po ang probability na magkaroon ka nito reboundly. Pwede siya mag-rebound, no? Kasi masyadong mataas. Kasi your high-fat diets are linked to your systemic inflammation. So tataas at tataas at tataas yan. Pagka tumaas yan, pagka tumaas ang inyong fat sa inyong katawan, maaari pong masira yung pong ating mga receptors ng insulin. And kapag po nasira yung ating receptors ng insulin, there goes your diabetes. There goes your hypertension. There goes your cardiovascular disease. There goes your intestinal diseases. No? Kasi po, yan pong ating pong high-fat diet, no, is linked to insulin resistance, and your insulin resistance is linked to a lot of cases, especially your diabetes, and the complications of diabetes, to include your hypertension and other cases like even cancer. So that's my take on ketogenic diet. So I don't give ketogenic diet unless kinakailangan nila. So ano yung indication for ketogenic diet? If the patient has epilepsy, which is refractory to medication. Diyan naman po talaga kasi ginawa yung ketogenic diet. Hindi po siya ginawa para sa pagpapapayat. Okay? And then this one, we have to have this one. You have to have this one, your herbs and spices, your fruits, your legumes, your whole grains, your nuts and seeds, because these foods are rich in phytonutrients, no? And then they can protect you against your chronic diseases. And then you can also give your vitamins and minerals, no? So ito po, now we have to think holistically. Ask, is there a better source or package to get these nutrients? It should be a whole food. If you are going to eat, it should be a whole food. An apple, no? An apple is a whole food compared to your apple juice. And you center your diet on a whole foods plant-based diet. So ibig sabihin, mas madami pong food na kinakain natin na plant-based, no? Hindi naman sinasabing kinakailangan maging vegetarian tayo. Pwede pa rin naman po tayo mag-meat, no? Pero kasi po ang tumataas naman po yung inyong antioxidants with that, no? Yung po kasing whole foods plant-based diet, we consider around 70 to 80% ng ating foods na plant-based, and then the other 20% or the other 30% goes to your meat products. And you eat a rainbow every day because your rainbow every day gives you your phytonutrient spectrum. No? Your phytonutrient spectrum, madaming benefits. Yung royal leaf natin, red, orange, yellow, green, blue, indigo, and violet. So you eat a rainbow every day. No, you eat a rainbow every day, and then you have your anti-inflammatory. You have your anti-cancer. You have here for eye health, especially your oranges. No, yung mga kulay orange natin. It's a good source of vitamin A. Your yellows are a good source of your for your eye health. No, kasi your yellows sometimes linked to your omega-3 fatty acids. No, so for greens naman natin, you have anti-cancer, anti-inflammatory. No, specifically your anti-inflammatory kasi po tayo po we are living in a highly inflamed world right now. And then we also consider having your supplementation. So we give your vitamins and mineral supplementation and antioxidants kasi po yun pong antioxidants ay para po yung nagpapakalma sa ating mga free radicals. Okay? Magpapakalma yan sa ating free radicals because your free radicals naninira yan ang ating katawan. And what happens to your free radicals? Kasi parang ganito siya, no? If you can see me, no? Parang bilog, no? Oxygen yan. Oxygen po yan, no? Tapos meron silang dalawang pairs of electrons. And then usually ang free radicals po nasisira or nawawalan ng isang pair of electron. What happens with your antioxidants, no? Yung mga antioxidants natin, pwede tayo magbigay ng vitamins, minerals, antioxidants, no? Your vitamins, minerals, antioxidants restores the balance by giving out another pair of electron. So yan yung ginagawa niya. Plus, in diabetes mellitus, it has been proven that people with diabetes have decreased coenzyme Q10. No? Ano ba yung coenzyme Q10? Ang coenzyme Q10 po, yan po yung nagpa-power up ng ating electron transport chain. Your electron transport chain gives you your energy. So napatunayan po sa mga pag-aaral na supplementation with coenzyme Q10 for patients with diabetes mellitus ay nakatutulong po as a supplement treatment para mapababa yung kanilang insulin resistance. Plus, ang coenzyme Q10 po ay binibigay din po sa mga pasyente na mayroon noong mga statin drugs. Kasi po nagkakaroon sila ng problema. Sila ng masa ating mga muscles are rich in antioxidant and your coenzyme Q10 sana. However, nagkakaroon po ng problema yan dahil po bumababa po yung coenzyme Q10 as we age. So, the coenzyme Q10 is needed for patients with diabetes mellitus. And then what else? Your resveratrol. No? Your resveratrol and cardiovascular diseases are known. No? Nakakatulong po itong kasing resveratrol to scavenge your free radicals. No? Your free radicals naman, yan po yung naninira ng ating katawan. And your resveratrol limits the lipid peroxidation process or the degeneration ng ating mga cell membranes. And then we can also give yung mga kulay violet, no? Kaya kulay violet ito dito, yung mga color violet na ating mga berries, because your berries nakakatulong po yung berries natin, specifically yung mga blueberries natin, no? And then your bilberry extracts, nakakatulong po yan para po ma-restore yung balance doon sa inyong retina. Kasi po yung pong inyong bilberry extract rich in anthocyanidins. Your anthocyanidins naman ang nakakatulong para po ma-block natin yun pong mga radiation. And then yung radiation, ang ginagawa ng bilberry extract ay yung anthocyanidins nila ay nagre-restore ng balance doon sa inyong retina at tinatanggal yung inyong mga free radicals doon, no? So you take that one tablet, pwede pong one tablet at bedtime or one tablet at bedtime, and then before kayo kumain or after kayo kumain ng hapunan, and then before bedtime pwede nyo i-take. And then this one just shows you that that resveratrol around 500 milligrams twice a day, no, can decrease your systolic blood pressure, can decrease your fasting blood sugar, can decrease your HbA1c, decrease your insulin resistance, and increase your HDL level. So kahit 500 milligrams once a day lang yan, or twice a day lang yan. And then, ayan, so kahit nga 10 milligrams nga lang, 10 milligrams per day lang, ay nakakatulong na rin po no, sa pagpababa ng inyong insulin resistance. Right? So, magandang clinical study po yan. No? And then, we also have here your omega-3 fatty acids, especially nowadays that your omega-3 fatty acids sa ating mga katawan or sa ating mga diet ay hindi po mataas or mababa masyado yung ating omega-3s. Ang mataas po sa ngayon is yung omega-6. What happens there kapag po mas mataas ang omega-6 kaysa sa omega-3? Mas nagkakaroon po ng inflammation. So ang gusto natin ay magbigay tayo ng omega-3 to maintain the fluidity of the membrane, to maintain healthy function of our cell membranes. This one is your cell membrane. And then you also have here anti-inflammatory. Okay, so anti-inflammatory po kasi natin ito pong omega-3 fatty acids. And it is key for the photoreceptors of your eyes to be nourished. No? So yan po yung ginagamit natin pag-nourish po ng photoreceptors ng ating eyes. Again, we see the patient as a whole. No? So hindi lang basta mata. Kasi baka may iba pa siyang problema. So we see the patient as a whole. We give your supplementation, no? We give your food, no? Your whole foods, plant-based diet, exercise, and then we give everything, no, na ganyan. So ayun. So food is medicine. Your kitchen will be your pharmacy, and your lifestyle will be your doctor. Sabi nga po ni Thomas Edison, the doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease. Okay? And then sabi po ni Hippocrates, the father of modern day medicine, the doctor, everyone has a doctor in him or her. We just have to help it in its work. The natural healing force within each one of us is the greatest force in getting well. Our food should be our medicine. Our medicine should be our food. But to eat when you're sick is to feed your sickness. So dyan po pumapasok, yun po ang ating intermittent fasting. And that is another topic for everyone. No? So I'll answer some of your questions. And if you have time, I'm inviting you to check out my Facebook page. Now, my Facebook page is facebook.com/askdoclex and my YouTube channel. So nag-vlog po ako. So here, makikita niyo po dyan yung pong ating mga na ipasok na sa vlog, no? So nagagamot po ang diabetes. So if you want to learn more, you can click that, or you can go to our YouTube page. It's youtube.com/Dr. Dex Makalimtan. So I'll answer some of your questions para may magawa naman ako para sa inyo. So yes, dumadami na po talaga diabetic ngayon. Minsan sa clinic mayroon tayo 3 to 5 patients. Yes, many times a day, nasagot na natin yan kanina. And then, what is your take on ketogenic diet? Pasagot na rin po natin yan kanina. Your ketogenic diet increases your inflammation, which causes more problems than cure. So wala pa pong study na mas maganda ketogenic diet over other types of diets. Your ketogenic diet, ginagamit po talaga kasi yan for epilepsy na refractory to medication. So your ketogenic diet is not really recommended for weight maintenance or for weight loss. It is because, no, ayon po sa mga pag-aaral, maaari ka nga mag-lose ng weight for the first 2 to 3 weeks. Pero after 24 to 26 months, there is high dropout rate. Kasi po nagkakaroon na sila ng problema with brain, nagkakaroon na sila ng problema with mentation, bumabalik na, tumataas na ulit yung mga titers nila, tumataas na ulit yung inyong mga asukal, no? So yan. And then, ayan. Hi doc, can a patient reverse their diabetes? What about those people who are on long-term insulin? Can they reverse it? The answer to this question is, depende po sa kagustuhan nilang ma-reverse ang diabetes. If they really want to reverse their diabetes, there is a way. And that way is to change their lifestyles. Kasi po ito naman po ang ating mga sakit na ito ay nanggaling po sa ating uri ng pamumuhay. So meron na po tayong mga na-reverse na diabetic patients na at tagal-tagal na nila sa kanilang mga doktor, dating doktor, walang nangyayari. So pumunta sa atin, dito sa ating klinika, at nare-reverse naman po yun pong ating diabetes. So yes, nare-reverse po ang diabetes, especially kahit naka-insulin na kayo. Kasi po minsan, there's just a problem with microbiome. There's just a problem with the assimilation system, or sometimes there is just a problem with how the insulin will work on them. Kasi po minsan masyadong mataas yung insulin resistance, kailangan lang natin siyang pababain. No? So yes, they can reverse it. Doc, can we have an executive exam with you and you assess my family's health risk and correct the diet and lifestyle that we should have? Yes, you can just send us a message at facebook.com/askdocdex or facebook.com/Dr. Makalintal. And then, ayun. So, yan. Good yan. Announced prevention, yes. Doc, can we take resveratrol as supplement on a daily basis even without diabetes? What is the milligram recommended? Okay, with resveratrol po, you can take this naman. Sometimes your resveratrol, no, yung tinatake ko, ako mismo, tinatake ako nito. Resveratrol, no, your resveratrol comes with your vitamin C. So the milligrams here is around 500 milligrams of vitamin C plus 100 milligrams of resveratrol para na re-recycle yung ating anti ROS plus twice a day yan, no? So yan. And then so pag na-reverse na po ang diabetes, stop na po maintenance. Yes, kasi po pagka na-reverse natin ang diabetes, ang mangyayari po diyan ay hindi mo na kailangan ng maintenance kasi kapag na-reverse mo yung diabetes, okay na yung sugar mo, pagka nag-take ka ng maintenance mo, babagsak yan. Pag bumagsak yan, you're hypoglycemic. Pagka hypoglycemic ka, you're prone to fall, you're prone to more damage, no? So, ayan. And then, isa pang kwento dyan. Another dyan, minsan hindi kasi to your diabetes kasi, no? Hindi naniniwala yung ating mga conventional doctors, no? Yung mga kasamahan namin, hindi agad sila naniniwala na nare-reverse yung diabetes kasi hindi naman po kasi yan pinag-aaralan sa school namin. So in lifestyle medicine, yan napag-aralan po namin yan na nare-reverse naman pala talaga ang diabetes. So ang ginagawa, hindi kasi sila naniniwala na reverse na yung diabetes. So what I do is that after 3 months, no? After 3 months minsan, pinababalik ko sila sa kanilang mga doktor. Balik po kayo sa inyong mga doktor. And then what will happen is that you ask your doctor na kung pwede mo nang tanggalin yung metformin, kunwari, no? And then sasabihin ng doktor mo, wala na naman tayong diabetes eh. Baka bumagsak lang to. Baka mabagsak lang to. Your blood sugar is very, very low. So why are you still taking your metformin? Or why do you take metformin for? Or what do you take metformin for? So you can take your medications off na. And then sasabihin mo nila sa patient, sasabihin sa patient, sabihin mo sa doctor, doctor, I have already taken out my medications since 3 months ago. So yun yung nangyayari. So that's what I do. No? So what is the ideal dosing of antioxidants, doctor? Will it not lead to vitaminosis? Okay. So the ideal dosing of your antioxidants depends on the antioxidants that you have. No? Sometimes there are companies na nakalagay na dun sa likod ng tableta nung bote nila kung ilan yung optimal doses. No? Minsan 4 tablets a day. No? Depende kasi yun for optimal health. No? Just choose something that will nourish, protect, and renew your cells. And then just choose something na for me ay yung walang nakasulat na no approved therapeutic claims. Kasi kapag kami nakasulat dyan na no approved therapeutic claims, ibig sabihin hindi yan dumaan ng maayos sa pharmaceutical grade. No? Dapat kung magte-take kayo ng antioxidants or vitamins and minerals, dumaan doon sa pharmaceutical grade, hindi lamang siya food grade. Right? In your practice, your medicine are all natural food. In my practice, kasi I'm still starting out, I still give your synthetic medications. So, yung synthetic medications ko po na binibigay pa rin yung mga metformin, mga glimepiride, mga losartan, basotan, mga fenofibrate natin, binibigay ko pa rin po yan. No? But then again, the advice is that they will not maintain this. They will not forever have this. Kasi po, think of it. If you're going back to your doctor, if you go back to your doctor and then sasabihin mo, doctor, magpapa-maintenance po kami. Ito po yung laboratory ko. Then your doctor will go like, titingnan niya, sasabihin niya, sige, patingin ako ng laboratory mo. So, ganito ang mangyayari, di ba? Nangyayari dyan, laboratory mo, titingnan niya, tingnan yung laboratory mo. So, ito yung laboratory mo, so titingnan natin yan. Pagka nakita natin, sige, ano nga maintenance mo? Naka-metformin ka, ganyan, metformin. And then your losartan, your amlodipine, pare-pareho na lang. And then your doctor will give you will give you your prescription. So wala na nangyari, di ba? So ang nangyari lang doon, your doctor is not really your doctor. Your doctor is your highly paid secretary. Di ba? Come to think of it. So what I do is to advise them on food. What I do is to advise them on their lifestyle. What I do is to advise them on the supplements that they will take. Kasi minsan, nagkakaroon na ng imbalances eh. In health optimization medicine, we optimize your health. We want to optimize your health to the point that you will not need your medications anymore. Because if you still need your medications, or if you still need your medications, then hindi ka gumagaling. Diba? Tama naman eh. So what are you maintaining? Are you maintaining your health or are you maintaining your meds? Diba? So you choose. What do you want? Do you want to maintain your health or do you want to maintain your meds? Baliktarin ko. Do you want to maintain your meds or do you want to maintain your health? Diba? So you choose na lang po. So can be virus, resveratrol, OTC. Ang alam ko meron na sa healthy options. Pero yung resveratrol ko and yung aking ibang supplementation ay I buy them from the States. May link lang ako na binibilhan. So yun po. Where do you practice? Can we have an online consultation? My practice is in Lipa City, Batangas. And then, ayun po, doon ko po titingnan pasyente. And then, can we have an online consultation? Yes, you can have an online consultation with us. And you just go to facebook.com/Dr. Makalintal. And then you visit our YouTube page muna. And then you subscribe. Okay? Para ma-monetize ako. Yan. And what specific vitamins can you recommend and where can we get them? So, message nyo po ako or si Tita Nori kasi mas may alam dyan. Mas may alam kami na yung binibigay namin. Or we'll get it tomorrow. Yeah. Okay. Sige po. Send us a message. My daughter has thalassemia and I believe lifestyle medicine can help her. Okay. In thalassemia, marami po yan. No? It's alpha minor, alpha major, beta minor, beta major. So you have to see muna kung alin doon. And then we'll run some tests. Baka naman ikakaroon lang siya ng, baka makatulong sa kanya. No? We cannot reverse thalassemia, but we can optimize the health of the patient naman. And then, ayan, nagalingan. Okay. Sige po. I guess wala nang questions. If you have other questions, you can send them here. No? So, ayan. So, habang wala pang questions, I'd like to invite you again to subscribe to our YouTube page. We have 87 people here, so I am expecting to have 87 more subscribers in our YouTube page, and then baka tomorrow we have another episode of Smarter Saturdays. So here, alamin lang natin kung ano yung mga pwede natin magawa for our patients, and then I'd like you to develop a keen sense of understanding sa ating mga pasyente. Kasi po baka now ang kailangan lang po natin ay intindihin sila. No? So to optimize our patient's health is to optimize our own health pa rin. And to optimize our patients, we have to optimize our senses para mas maintindihan natin sila. Okay po? Maraming salamat po.
Thank you so much, Doc Dex. So I refer all my patients to Doc Dex.
Yes po.
So we have online consultation with him, and then he has all the prescription that we needed, no? So he's part of our team. You remember last time we presented our team. So thank you so much, Doc Dexter. Sa uulitin, mukhang marami na